Ladies and gentlemen, honorable guests, to all of those who are following us on social media, good evening and welcome. Welcome to another UN Talk. For today, we are going to be discussing different topics. But before we start, allow me to do a brief introduction in both Arabic and English. قبل ما نبلش جلستنا لليوم، أول شيء بدي أحكي لكم يسعد مساكم وأهلا وسهلا فيكم. وبحب أذكركم إنه رح يكون في عنا لايف على اليوتيوب ورح يكون باللغة الإنجليزية، والترجمة باللغة العربية رح تكون لايف على الفيسبوك لليو جوردن باللغة العربية مثل ما ذكرت. So before we start with our panelists, with our panel discussion for today, allow me to start with a brief intro. A year ago tomorrow was the first case of COVID-19 that was recorded in the kingdom. Looking back at this year, we understand the effort that has been put by the government, whole of the government, and whole of the society approach. Difficult decisions were made in response to the pandemic, and those responses affected us economically, mentally, socially, and even physically. Health sectors experienced enormous pressure, but grew stronger. The government has been dealing with this unprecedented virus, and it grew more resilient. And the people's strong sense of shared responsibility has definitely strengthened. The new now we are living is all about the mask, the sanitizer, social distancing, skipping gatherings, online meetings. But what about tomorrow? What about the future of the upcoming generation and the consequences of this pandemic on it? The world must get back on track towards sustainable development, leaving no one behind. 2021 must be a year to continue progressing towards peace, stability, and opportunity for all. Allow me to switch to Arabic briefly. عام كامل مضى على أول حالة كورونا تم تسجيلها في المملكة الأردنية الهاشمية. وإذا نظرنا إلى هذا العام لوجدنا أننا تغيرنا وتغيرت حياتنا بشكل كامل. الحب صرنا نعبر عنه بالبعد، والقبل أو القبل والأحضان صارت هي السلاح. الكمامات والمعقمات أصبحت هي الطبيعة. أما على الصعيد الحكومي القرارات الصارمة التي لم نشهد لها مثيل في السابق وجدت لتحمينا وعائلاتنا. تأثيرها الاقتصادي والنفسي والاجتماعي كان ولا زال حاضر، ونحن على ثقة إنها رح تكون المستقبل الآمن لا وجود للكورونا فيه. القطاع الصحي في المملكة إذا ما تحدثنا عنه فهو تطور بشكل ملحوظ وبوقت قياسي. حاليا يوجد بالأردن أكثر من 4000 سرير مخصوص لحالات الكورونا في المستشفيات الحكومية والخاصة والميدانية. وبعد هذا كله نرى أن العالم بأسره يتوجه للتنمية المستدامة الشاملة. لنأمل أن تكون سنة 2021 سنة لمواصلة التقدم نحو السلام والاستقرار وإتاحة الفرص للجميع. إذا ما راح أطول عليكم، اسمحوا لي نبلش بالسيشن الأولى and allow us to start with the first session. And our panelists for today are Mr. Anders Peterson, the UN Resident and Humanitarian Coordinator, Brigadier General Mazen Feraye, Director of Operations at the National Center for Security and Crisis Management, and Saverio Bellizzi, the Emergency Team Lead of the World Health Organization here in Jordan. Welcome, dear panelists, and thank you for being here with us today. So allow me to start with you, Mr. Anders. If we're talking about the international community and it coming together during those hard times, it's been a year, and this year has created huge change in our lives. Let's briefly start with that.
Well, thank you, and thank you to all of you to be with us here tonight on this UN talk. I mean, 2020 has been an unprecedented year for all of us, for the globe at large, for nations, for people.
Right.
And we've all have had to live through some of the most difficult times in our lifetime, in modern times. I also think it's absolutely true to say that even in a country like Jordan, the numbers are staggering. But I really would like from the onset to say that if it would not have been for the way that the government of Jordan has actually responded, with the support of all of us as members of the international community, we would have been much, worse off.
True.
And I think that's important as a point of departure for this conversation, that we've learned from the past, 2020, and then, of course, when we're going to look forward for 2021 to see how we can manage all the impact that's going to be with us for quite some time.
100%. And Brigadier General Mazen, if we're going to be talking about the key steps that were taken by the government itself in order to face the pandemic throughout this past year, if we're going to be talking about three main things that have happened, what would you focus on?
Yes, first of all, thank you very much for this invitation. If I would talk about something that was a key for the success of our government and our nation to deal with this pandemic, first of all, it's our ability to balance between economy, social, and health aspects. It was a very difficult thing to do, quite frankly. People are supporting you for extended period of time, and by the time they get bored, they get tired of suffering from economic loss and want to go back to work. Employment is becoming an issue. So it was difficult for government to balance its actions on the ground. At the same time, the other thing that I think is very good to talk about is our ability to build our health sector, as we are maintaining our the way we've been affected by this pandemic to a level that we can handle gradually, and I think we've managed to increase our capacity, health capacity. That was gaining time was a very good thing that we've thought about right from the beginning, to make sure that we give our medical sector the time to build itself, to train our staff. Quite frankly, this pandemic is, the whole thing about this virus was very new. There was kind of ambiguity about what this virus is about, how long it's going to be with us, and what will the circumstances are we going forward. So these are another thing to do. The other thing is how can we involve our all our resources and coordinate it in the crisis management center to make sure that all our institute and entities are working together, military, security, health sector, all working together to make sure that this balance that I've just talked about is happening. We want to make sure that the impact of this pandemic on our people is as we could. So those are three things I think the Jordanians will remember for years to come. I think I would say we've been successful at some stage. We have to suffer more at some phase, but I hope the future will be better.
Allow me to say that your efforts are highly appreciated by the whole Jordanian community.
Thank you.
Sleepless nights have passed, and yet we see them working day and night to make sure that us as people living in the Hashemite Kingdom of Jordan are living the best life there could be amidst this pandemic. Going back to you, Mr. Anders, if we're talking, as Major General was saying, it's all about adjusting. 2020 was the year all about adjusting. I mean, the masks and what they've done to us, right? If we want to talk about the adjustments that happened within the UN programs here in Jordan, where would we start?
Well, firstly, you see the difficulties of actually wearing the mask, but we're trying really to keep the three ones always at the core. I think, following what the general is saying, not only did then the government, but really if there's one thing that I am, as a representative of the United Nations, as a member of the international community in Jordan, would say that I'm particularly proud of, is the way that we were able and capable of coming in behind, in a comprehensive, in a coherent, and in an aligned way behind the government's priorities. And I think that's really one of those things that I take with me, that we did not suddenly create new structures and try to build new systems and new institutions. We actually were capable, the huge international community here in Jordan, to come in and build and expand on what already was there. That, I think, has been an absolute key in the way that we've been able to work together. And I really think we have to acknowledge it's definitely not only about the United Nations. It's about the what we call the IFIs. It's about the World Bank, the IMF, and it's about our big bilateral partners here that expanded rapidly their response and could come in everything that Jordan was doing. Linked to this, the other thing that I would think was absolutely key is that as of day one, we developed what we have been calling a three-tiered approach. So first and foremost, of course, responding immediately to the health crisis. People were getting infected, people were dying, we had to respond. But that's not enough. The pandemic very early on demonstrated that it's so much more. So secondly, it was about keeping the life-saving assistance that we are providing, particularly to the big number of refugees living in Jordan, so that they would be kept really serviced in the way that we have an obligation to do. But thirdly, and I think that is what we're going to see now, as of day one, look at what's going to be the impact of the pandemic beyond its health dimensions in the medium to long term. And that's where we are now. Now, this is not just a health crisis. This is a socio-economic crisis that's going to impact all people living in Jordan for the foreseeable future.
100%. And just to confirm, it's not only in Jordan, it's like worldwide, but because we're focusing on Jordan, we are just mentioning
it's all
Jordan.
over the world, right? But I'm in Jordan.
100%, totally agree. So, Mr. Saverio, if we're going to be talking about a year that has passed, and during this year, going from being able to visit our families, travel the world without even thinking twice, to simply staying in homes, in our houses, being super strict about gatherings, keeping our distance, so on and so forth. I think that we've memorized by now. There must have been a huge change in the World Health Organization's movement towards making it easier for people in general. What has been the approach since March last year?
Thanks for this question, very, very pertinent. Why? Well, the World Health Organization in general is the UN agencies that promote health, well-being, and all around also what you said before, leave no one behind, so universal health coverage. When it comes to the pandemic, we are the one that try to support at a global, regional, and country level the preparation, but also the response to the epidemic. What does that mean? We try to support countries, specifically the Ministry of Health, in response to specific aspects like infection prevention, how to protect yourself, how to treat the case of COVID-19, and many other aspects. One particular aspect I would like to highlight is that we do that evidence-based. So since the first day, we try to compile, summarize the best evidence on what are the key actions to deal with each of these aspects. To give you some very, very practical, example, we always think about quarantine for 14 days. But why 14 days? Because from this experience research, it emerged that the characteristics of the virus is that after 14 days of contact, you don't have more time to develop the disease if you were a close contact, if you were tested negative. So I mean, these are really key point, and that's why it was a very exciting and challenging year, because since it is a new virus, as it was said just before, we had to adapt, specific guidance to countries depending on the research at different time. Now, when it comes to Jordan, it was, I would say, an easy job. Why? Because our relation with the government, with the Ministry of Health, was excellent since the beginning of the epidemic. Thanks also to our WHO representative here in Jordan, Maria Cristina Profili. And this allowed us to be on board immediately at the beginning of the onset of the epidemic, in the epidemic committee, in supporting the country with the different aspects. And this job is ongoing. I'm just coming back from the Ministry of Health, and we were just discussing about possible other actions in terms of specific technical aspects.
Wonderful. So when we're talking about the World Health Organization and its its role in combating different health problems that people may be facing. It's true, we are talking about the pandemic itself at this point, but the consequences of this pandemic isn't only being or having a fever or being homebound. It's also the mental health issues that a lot of people are currently suffering from. What is the approach of the World Health Organization towards this topic in specific?
Thanks so much. As you said, it's not just that there is the pandemic and the other diseases are stopping their work. It's also that the other disease, people affected by cancer, people with mental diseases, and many others, they still require your care. So that's why one of the aspects we are trying to highlight when working with the Ministry of Health is essential health services. So we are trying to strategize to find a really specific, guidance to the Ministry of Health on how to approach people in need of the different kind of care. Mental issues are a specific important, topic that emerged because of the social distancing, because of not going to work or just absence to school. And so that's why we are really having specific strategies on how to support people also for the future. And this is particularly important also for our children.
Of course, I totally agree. So, Brigadier General, if we're going to be talking about the most difficult situations that the crisis and the National Center for Security and Crisis Management have faced over this year, they're countless, I believe. But when it comes to Jordan's response and the Jordanians and different nationalities living in Jordan, how helpful was it, or what are we expecting from the Jordanians in order to make it an easier approach towards ending this pandemic here in Jordan?
Well, I think ending this pandemic in Jordan is still a big question to ask, quite frankly. It's not only in Jordan, I think it's all over the world. It's a very difficult question to answer. But since the beginning of this crisis, the Jordanians have been very helpful, quite frankly. They understood the measures that the government have to take. They've sacrificed their time. Some of them, they sacrificed their job. Not necessarily willingly, but they have accepted at the end of the day. We've been forced to take harsh measures at the beginning, doing quarantine for people coming from outside the country, in hotels, being in a hotel room for 14 days, closed door, is a very difficult thing to do psychologically, and this was a very hard period that the Jordanians have went through. Then we come to a time where we closed markets, shops, people in need to go out. There is all people who part of their treatment is to go out and walk. They couldn't do that. We have people who, as my colleague here just mentioned, they have different kind of diseases, and that they want to go to hospitals. It was difficult at that time with the lack of movement in streets. Those are things that we have issues with. By the time we start, noticing that people are dying also from not being able to be treated in normal diseases. The government relaxed the situation at some time when we have very few cases, and then we have to accept at that time that cases will get increased. That happens, of course, and unfortunately we've lost lives in this pandemic, and it was difficult to convince people every time and again that we need to go back to close markets, we need to go back to stop movements on Fridays. All the seasons are different. Winter time, now we are approaching summertime, where people want to go out and enjoy their lives. Also in Jordan we have social habits that have stopped completely. For example, previous Ramadan was not a Ramadan that Jordanians used to have. I mean, they've been forced not to go to their mosques and churches at some stage, and so it was very difficult time. But I would say Jordanians have been very successful at adapting to the situation. The government were very flexible. We have support from the population. We have support from UN organizations here in Jordan. We have support from WHO. We have support from our allies here in the country. Also going forward and starting our vaccine campaign. We are promising our people, hopefully we will be able to fulfill these promises, that by the time we will get closer to semi-normal life, still they need to wear the mask, still they need to do social distancing, but we hope that the more vaccine we have, the more people are coming forward and take this vaccine, the more we will be able to open our economy.
Definitely. So we are definitely going to consider it. We're going to be talking in specific details about the immune and immunization system in Jordan, how it's going in the upcoming panel session. So make sure you guys stay tuned. And since most of the people who are watching our live are I believe Jordanians, and there's a question that we're all still asking continuously to cut the rumors. People keep saying that there might be another full lockdown. Is there a chance for another full lockdown? Or
I think at this point it's very, very, very difficult to do that in Jordan.
Okay, so
Yeah.
this is very
No,
difficult.
I don't think this is going to happen, at least at this moment. But as you see, cases are increasing. But full lockdown will be very expensive.
Alright,
Will
so
be very
here's an
expensive.
answer
Yeah.
to your question that I believe everyone was wondering
Yeah.
about. And hopefully we'll be able to answer more questions. If you have any questions, please do share with us, be the comments area, whether it was on Facebook or on YouTube, and we'll try to specify a specific time for the answers. And if not during the live, definitely your questions are going to be answered. Going back to you, Mr. Anders, and when we're talking about the United Nations adjusting their programs, if we're talking about the pandemic itself and the different programs that were, I would say, changed in a way or another, the pandemic has definitely, I would say, affected the moving forward in the different programs. How are you looking into, let's say, coming back strong after those setbacks due to the pandemic? And again, because a lot of us had to work from home, a lot of us had to simply not show up at a certain point if they tested positive. So a lot of setbacks have happened throughout this year, and there were certain projects that were scheduled. What are we going to do with them?
Well, I think the number one to recognize this is not about going back to where we were. We have to build forward better. It is not about going back to where we were in 2019. The pandemic has demonstrated, unfortunately, that was not good enough. What it really has done is that it has demonstrated the vulnerabilities and the lack of resilience of societies all over the world. So what we've seen now during 1 year, we see decades of development thrown back. Decades of development has actually now regressed. And that's the challenge we have now. So for us, the absolute key is we have to build forward better. We have to learn from the experiences and make sure that we are better equipped when we get out of this, because there's going to be new pandemics. The epidemiologists are going to tell us that this is not the only one that we're going to experience, most unfortunately. So we have to be stronger. And unfortunately, like in all crises, and definitely now, it's the most vulnerable people in society that have suffered the most. And that's extremely important to remember. Most of us may be listening to this and sitting here, we are the privileged. But those that under normal circumstances are vulnerable, they are even more vulnerable today. So for the United Nations, what we are really keen to put forward is that everything we do, whether or not it's about driving growth, whether or not it's about our investment policies, whatever it is, we have to keep a very, very clear focus on the most vulnerable and what we call leaving no one behind. That's the only way to build a sustainable future that really then will live up to the Sustainable Development Goals and to the Agenda 2030.
we are definitely looking forward for sustaining our lives and sustaining the development that we want to approach. But apparently, the coronavirus isn't on the same level as we are. No sustainability with that, and we keep seeing new mutations for the virus itself, right? So when it comes to the virus itself, Mr. Saverio, let's talk about what can be done in order to face the pandemic. Since yes, we've got new mutated viruses and some tell us we should deal with them the same way, and others go like, no, they spread way faster. You have to cut down on some of the things that you already that you are doing, and it's just a bit confusing for us as normal people not working with the World Health Organization or in the medical sector. What are we supposed to do?
It would have been simple to have the same virus since the onset up to the end, but as I told you, it's a challenging year. Let's be clear, pandemics are not new, pandemic will be also in the future, and the issue of the variants is nothing new. By nature, viruses, they tend to change slightly to be more adaptable to the body they get into. So it's the issue of the new variants is there, is nothing new, and will continue as long as the chains of transmission, the epidemic will go on. This is the bad side, even because these new variants, most of them are a little bit more transmissible, and that's why we are experiencing more cases very rapidly in different settings. However, there is a good side. Which is the good side? The tools that we have to prevent the infection are exactly the same. So hand washing, using the mask, avoiding gathering, close settings are exactly the same tools that we are promoting since the beginning of the epidemic. I know that people are tired of all these things they keep hearing, and at the end you are quite exhausted about this. But let's continue to work on this, because they are a simple tool that if well put in place, they will help us to slow down again the epidemic, not only in Jordan, but everywhere.
100%. If since we are coming to an end with our panel discussion, Brigadier General, if there is something motivational, I would say, you would like to tell all the Jordanians, because as Mr. Sivario said, we are tired as a Jordanian community, and the whole world was tired. We're tired of lockdowns. We're tired of staying at home on Fridays. We're tired of the whole pandemic and the coronavirus that's happening in the world. 1 year ago, we were living our lives to the best, and now everything is being postponed and shut down. What is one thing that we'd like to tell the Jordanians in order to stay motivated and face this pandemic together?
Okay. Well, first of all, I think our knowledge about this virus is becoming better as we go forward. I think the vaccine campaign that we are conducting right now is promising. We are expecting more vaccines to be coming to the country very soon in March. Hopefully we'll have support from our friends and allies in the world to make sure that Jordanians are receiving this vaccine. So far we've given our priority to all people who are more subjected to severe circumstances if they get this virus. We've seen increase in our centers to give this vaccine. So the vaccine is very motivation. We want our people to come forward and register to take this vaccine. We want to stop talking about rumors about this vaccine. We want to leave this circle of suspicious about vaccination. The government is trying its better to reduce its measures on the ground to make more space for people to enjoy as normal life as we could. So I think other than that, we need to be patient. We need to continue to wear our mask. I'm sorry to say that, but we have to. And at the end of the day, I think this is not Jordan. I think this is the world working together to overcome this big problem and pandemic.
Thank you, sir.
Thank you very much.
Mr. Anders, what are your final comments after today's session?
We can make it together. We can come through this together, and we can actually come out of it better together.
I totally agree. I mean, during this past year, we have witnessed a lot of people who did see the spotlight because we decided to come along strong as a Jordanian community, helping others, looking forward to, especially those who work on daily basis and get paid on daily basis. They were supported. People who weren't even heard of now are being heard of big time. So yes, there is still positivity in everything that has happened, whether we believe it or not. And Mr. Sivario, if we're going to be talking about the World Health Organization, and as we said, not only do we talk about health that is seen, but also the unseen and the mental health, and part of it has exceeded due to the pandemic. What is the word that you'd like to tell everyone? And if we do know anyone who is facing mental health issues due to the pandemic, what do we tell them?
The first message I would like to convey is that trust is important. So trust your government, trust the Ministry of Health, because there are specific strategies that are done in conjunction with the World Health Organization that are specifically aimed to tackle the different aspects and consequences of this pandemic. Mental health is one of these. So there are, hotlines, there are telephone numbers, there are specific programs that are adapted and contextualized to the reality of where we are.
100%. Dear panelists, thank you so much for being with us for today. Thank you for all of your hard work, Mr. Anders Pedersen, the UN Resident and Humanitarian Coordinator, Brigadier General Mazen Faraye, Director of Operations at the National Center for Security and Crisis Management, and Mr. Saverio Belezzi, the Emergency Team Lead of the World Health Organization in Jordan. Thank you so much. And once again, I believe I say in the name of all Jordanians, your hard efforts are highly appreciated, and we're looking forward to, I would say, simpler 2021. We'd be super happy with that. Have a wonderful evening, and thank you for being here with us. Ladies and gentlemen, once again, to all our viewers, whether it was on Facebook or YouTube, thank you for joining us, be our first session and our first panel. The next panel is going to be in few minutes. Make sure you stay tuned, because we're going to be giving you details about the immunity, the immunization program, and the vaccines in Jordan with our next panelists. Stay tuned. Ladies and gentlemen, once again, welcome to our talk and our panel discussions for today. UN Talk, putting people first, responding to COVID-19, that's the title. And a huge part of the COVID-19 is definitely the vaccine, the immunization, the immunity of a person. How is it looking? Where are we going? And what is happening? I know we're all asking those questions, and we're here to answer all of them, inshallah. Once again, we are live with you on Facebook and YouTube. On Facebook, we've got the Arabic translation live, and on YouTube, we've got the live English going panel discussion. So it's time for our second session for today, and with us, Dr. Wael Hayajne, Minister of Health, Secretary General for Epidemiological Affairs, and also be our second panel. Our second panelist is Dr. Chiara Aidra Liva. Hopefully I said your last name correctly. I'm sorry if I didn't. And of course, she's the Public Health Coordinator, World Health Organization immunization in Jordan. Once again, when we're talking about the immunization program and the vaccine system that is happening, we have been continuously telling you all over social media platforms, the Red, the Heard, and the Seen, that you should head to vaccine.to, this website. It's a very simple process. You register to get vaccinated. If you know any elderly, please do get them vaccinated as well. Where are we standing? Why are the numbers so low? And what are you worrying about? If you do have any comments or questions that you'd like to share with us, please do share with us on right here, whether it was on YouTube or Facebook. Be your comments, your questions, and hopefully we'll get those answered throughout the live. Dear panelists, thank you so much for your time and all your efforts that we've been seeing over the past year. And allow me to start with you, Dr. Wael. When we're talking about the biggest investment today, it's been a year when it comes to addressing the ongoing upsurge of cases in the kingdom. And today, as we all know by now, it's more than 6,000 cases. What are the investments that have been done, and where are we standing? What should we be expecting during the upcoming period, if you may?
Thank you very much for hosting me tonight. It has been a long, long year, a hard year for me as a physician, as a surveyor, as a guy who goes into villages and towns. Then now as a government official, it has been so long, so hard, and we really feel so bad for the vulnerable people. We are trying to stand by today. During this last year, and I think Jordanians have proven that they're good, they're strong, and they can come up with a better future. And from the health point of view, there are certain issues that have been addressed over this last year, and I want to address a few of them. We have been in a situation where our hospital capacities were not good at the beginning. So I can tell you today that with the help of our partners, with the help of the people, with the help of the international community, we have managed to increase our hospital capacities at least 4 times in 1 year. I can tell you some numbers. Our regular beds for COVID-19 in the beginning were about 700 or 800. Now we are talking about 400,000 beds. We're talking about a few hundreds of ICU beds. Now we are about to reach 700 or 800. So our hospital capacities have increased, quadrupled at least. So that's why we feel a little bit better today. We don't feel better that we are admitting patients, but we feel better that we are able to take care of them more than at the beginning of the problem. So this is a very important achievement, an investment that we have made. And we prayed not to see another wave to try this investment, but it seems happening. And we are trying them now. The other big investment that we have witnessed is developing and improving our laboratory capacities. I can tell you with some certainty that at the beginning of the problem, the polymerase chain reaction or the PCR testing in Jordan were not exceeding maybe 1,000, 2,000 tests a day. For example, today, we have reached the maximum number of tests that we've done since the beginning of the pandemic. Today, we exceeded the 40,000 PCR tests in 1 day. And this means that we have now made access to such capacities all over Jordan. We have labs in all 14 health departments in Jordan, in the 12 governorates of Jordan. The capacity have increased from 1,000 to almost 49,000. So 49 times increased capacity of PCR testing in Jordan. I'm talking about public sector, private sector, hospitals, academic places, and the army, of course, the Royal Medical Services. Plus, we are going now, with the help of our partners, WHO, into using rapid tests for diagnosing coronavirus. However, we're going to pass this hard time, and we're going to use these PCR capacities for other diseases, that we have been thriving to have better diagnostics and laboratory capacities to diagnose. So we're talking about hospital capacities, laboratory capacities. There are other important things. Ministry of Health, just like any other public sector in Jordan, they have been seeing deficiencies in human resources. And I can tell you with confidence that in the last 3 months, we hired at least 2,200 employees for the Ministry of Health itself alone. This is the biggest investment that I think of, because you are investing in human resources. Human resources, and not just hiring them, but training them. Then thanks again for the international community who help us in training these employees, getting them in the right track, giving them the right skills to do their jobs right with the patients in the hospitals. Physicians, nurses, medical technologists, pharmacists, everybody. And that also adds to solving the problem in Jordan of having better health being introduced to Jordanians in our hospitals. So human resources. The other thing is we have developed our surveillance tools with the help of our partners. Today, we are confident about how many tests we do every day. We know how the cycle works. We know who calls those patients at home in quarantine or isolation. And this is a very important step that it took too much time, too much effort, and too much help to develop. 100%. And one of the other achievements that really is important is how to develop an electronic health information system that is pertinent to COVID-19. And now we have certain dashboards, certain systems that look into investigations, look into tests, look into immunization at the surveillance stage. And these are investments for the future. COVID will be there, but will not be there as the main problem. And we're going to use these resources for other things. And these are for the future, inshallah. Inshallah. Of course, we'll talk about immunization, but that will take another track.
100%. We're talking about huge investments that have been done, whether it was with human resources, with the human capacity, and that's the thing that His Majesty King Abdullah II continuously affirms, is that Jordan is a country that is built on its human capacity and the strength of its youth. And honestly, I would say that we have seen them develop drastically, whether it was from community service to the medical field. Those two extremes, we've been witnessing an excellent approach from our youth in developing the different sectors, and one of them, as you mentioned, in the health sector. If we're going to be talking about the other main thing that people are talking about, we're definitely talking about the vaccines. The vaccines in Jordan have been the highlight of every single chat, of every single event that I've been to. I don't go to many gatherings. I do keep my distance, promise. But even if it's a couple of people or we're talking over the phone, people are continuously asking, are you going to get vaccinated? Did you register? What type of vaccine is better than the other? We heard a lot of rumors about this vaccine. You shouldn't take it. We need to put an end to these rumors. And there is no other expert than you, Dr. Shinara, in order to answer all those questions from our audience that I believe that people over the live are just waiting for answers about. Let's start with the vaccines in Jordan. What are they? Do they have any side effects that people should be worried about? And how much do you recommend people getting vaccinated?
No, we have a lot of hope with vaccines, and this is basically the only tool which is controlling the pandemic. The rest is preventing transmission. We are talking about washing hands, keeping social distance and reducing gathering. So we have a lot of hopes, and I think worldwide there have been outstanding efforts in development of vaccine. Although they have been developed in a very short period of time, they have passed through all these phases that are required, including the clinical trials with tens of thousands of people, so they are extremely safe. And now we have witnessed, as of yesterday, the world has administered worldwide, there were almost 250 million doses of vaccine have been administered, and very few side effects, which was I think in agreement with results of the phase 3 trials. So there are some side effects, this is inevitable, but this is for every vaccine. They're very rare. They're like 2 to 5 cases per 100,000. These are not deaths. We call it serious effect. Like one of the most common is anaphylactic shock. It's just anaphylaxis to the component of vaccine. But for that, Jordan made a remarkable investment and efforts in training vaccinators and having this first aid kits available. All the vaccination, I think, places, they have emergency room. Actually, it was really handpicked for this reason, to have access to the best emergency services in case there is a need. What is happening now in Jordan? There are 4 vaccines which have been approved by the Jordan Food and Drug Administration, which is a body which is allowing use of vaccine in Jordan. And all of them are very safe and very effective. So far, there has been only 2 vaccines in use. It's Pfizer-BioNTech and Sinopharm. So we were privileged to get vaccinated. So myself, I have received Sinopharm vaccine, and I'm very happy that the government of Jordan, although I'm not a national of Jordan, of course, but I had the privilege to get vaccinated in a priority group of healthcare professionals. So over to you.
Right. So we are talking about a lot of people mentioning that there might still be different measures. So if we're talking about a person getting their first vaccine, as we understood, they have to wait for 2 weeks until they get the second dose of the vaccine. Am I right?
It's 3 weeks, yes,
3
interval.
weeks. All right. So
21 days.
Dose, 3 weeks, you take the second dose, and then you have to wait for how long until the antibodies are built in the body?
No, you have to wait at least 2 weeks after the second dose, but I think 28 days after the first dose, you will already have kind of a good immune response.
Right. So the question is, after confirming those details, do people who got vaccinated still have to wear their face mask, keep their distance, and not go to gatherings?
Obviously, yes. This is something. First of all, we have pretty good knowledge about how vaccine works. So for time being, we know that they prevent disease and death. So they reduce the number of moderate and severe cases, reduce the number of deaths, but we have little understanding of how this affects transmission. So if the person who is vaccinated, if they cannot transmit to others, so they may still have asymptomatic or mild disease, and they might still transmit. That was not a part of trials. Only one company has been doing. They have had some reduction, AstraZeneca, by 2/3 in transmission, but still I think we have this sort of evidence that needs to be built. So for that reason, also, vaccines don't have 100% efficacy. So everyone will develop its own immune response depending on its kind of immune system. So for that reason, it's better to continue with these public health and social measures, like the same, I think, old story as wearing mask, keeping distance and washing hands.
100%. So, Dr. Wael, as a doctor, as you mentioned, you've been in different places around the kingdom over the past year. You've been discussing the COVID-19, the vaccine, the pandemic over the year, over and over again. But وممكن during the past year, a lot of people have said and asked the question that I have just asked you. We're talking about the concept that we are going to get vaccinated, we are going to apply for this vaccine, but at the same time, after we get vaccinated, we still have to wear the face mask, we still have to keep the social distance and all the things that we are asked to do. Why should I get vaccinated? This is a question that we've heard often, and I believe that, Doctor, you've heard it very often as well.
I heard it hundreds of times.
Right.
Well, let's start with the basics. And Dr. Chinara, I think, just added to that. We don't have a very good evidence, or don't have really good evidence that vaccines do delay transmission. As far as today, we don't know this for a fact. So we need to continue using our preventive measures, washing our hands, having our mask, avoiding gatherings, just like Severio said a few minutes ago. Plus, vaccines do prevent moderate or disease infection that will lead into admissions into hospitals. They might not prevent mild infection that do not admit us to the hospital. And this is very important. This is very important situation. So when you hear about efficacy, about 95% against severe disease, that's too good. And I can say vaccines are miracles. They bring social justice. They bring equity to people. They bring protections. They develop economy. They accelerate our going back to semi-normal life. We will not go to normal life.
Right.
So you're just, instead of treating somebody, you're preventing infections for millions of people, and that's very important. Let me tell you from the beginning, in Jordan, we're not inventing the wheel. We have a very strong immunization program in Jordan. I mean, for kids in Jordan. We vaccinate, our cohort in Jordan is about, live birth cohort is about 250 to 300,000 kids a year that go into this very important, what I call the most social system in Jordan, immunization. Immunizing every kid who is born in Jordan.
True.
Born in Jordan, not Jordanian. It can be any nationality, free for 11 or 12 antigens that we vaccinate in Jordan. So yes, vaccines, they are beyond doubts. We are in the 21st century. We cannot keep talking about rumors that vaccines don't work, that vaccines are part of conspiracies. This is the 21st century where science talks.
Sure.
And science proves what we are talking about.
100%. And Doctor, before we start our panel a few minutes ago, we were talking beneath the air, and you told me that in Jordan we had 135 different nationalities getting vaccinated for COVID-19. This is what's special about our kingdom. I know it's not the core of what we're discussing, but it has been the core of our daily lives. And that's why I keep saying I'm super proud to be a Jordanian. We don't only look at the Jordanian community and count the Jordanians, and they are the people who are going to get vaccinated. Every single person who decided to make Jordan their home, they are welcome to get vaccinated, and they can go on the website and apply for the vaccine just like anyone else, disregarding the nationality, disregarding who you are, what you are, where you're from. This is not important. This is not relevant, and it's a home for everyone.
Let me make this even clearer. Thank you
Yes.
for making this clear from the beginning. Our national immunization deployment plan, which was developed months ahead of starting our immunization by the help of our partners, of course, and it was developed under the supervision of the National Center for Security and Crisis Management, with all the partners there working together. We never discussed the issue of equity. This is a given in Jordan. You cannot discuss the right of a human being to receive a vaccine or not to receive a vaccine. This is beyond our rules. This is beyond our values, and we cannot even put it on the table. So everybody in Jordan, and I can tell you that some people are residing in Jordan illegally, they did receive the vaccines.
Wow.
We found the ways to give it. As of this morning, and I ran the Excel sheet, 135 members of 135 nationalities in Jordan did get the vaccine. Did get the vaccine. Now, our deployment plan is based on simple rules: justice, access to everybody, and inclusiveness. And our priorities are based on two very simple issues. If you are older or you are healthcare worker, then you go down with these priorities. There are 11 tiers along that rubrics or matrix that we vaccinate the people. But this is so everybody can go into this platform. Everybody can register. We have started with 75 centers all over Jordan, and these centers, some of the centers are in refugee camps, different refugee camps in Jordan. All Jordanian governorates are covered. And then recently, because of access issues, we have developed big, huge, very developed centers in Amman, in Irbid, in Zarqa, in Balqa, and in another area to receive thousands of people every day.
Wow.
We are preparing. We are ready, and we are equipped to vaccinate maybe 18 to 20,000 a day.
Wow.
Yeah, we're waiting for the vaccines. We have vaccines, but we are waiting for more vaccines. But we have to be transparent also with the people. There's a lot of demand in the world,
True.
and there are little supplies, or supplies that are taken by superpowers. We have to say that.
True.
We have the money to pay. We are self-financing country, sovereign country, and we are negotiating with every reputable pharmaceutical company to receive our vaccines.
Wow.
And we're willing to go all the way to do that just because we care about people who are living in Jordan. Back to you.
Thank you, sir, for all those details. And Dr. Shinara, if we're going to be talking about the vaccination or the vaccine passport, what is it? How does it work? And what do people need to do in order to get it?
Yes, I think this issue has been on the air for quite some time now. World Health Organization does not recommend vaccination passport because, first of all, we don't know the real level of immunity that has been developed by the individual after vaccination. So this passport means that, like, you assume that the individual is completely protected, the person is not kind of going to get the disease and spread the disease. So for that reason, and also maybe it's too premature in the whole global vaccination rollout. I know that several countries have been trying to introduce, like I heard about Denmark, that are planning to introduce, and there are some lifting. Of course, Jordan is with its electronic registration system of Vaccine.geo already has this electronic vaccination passport, because when you get 2 doses, you have a certificate which witness, the number of doses you receive and up to the lot number of vaccines that has been administered. But we don't recommend and we don't promote this idea of vaccination passport for the reason of, yes.
So can we give further details of what exactly vaccination passport means for our audience?
No, I think it's just kind of the name which was invented. In principle, there is only one international vaccination passport for yellow fever, which is recognized by WHO, and this is required under the international health regulation for travel to the countries which are endemic for the yellow fever. At the moment, there is no other vaccines which are kind of mandatory for getting this. So I think we still have a very long way to go to any vaccination passport from far. But of course, WHO is going to be revisiting this issue, but for time being, we don't recommend to have it.
Oh, no. So it's not recommended by the World Health Organization. And if we're talking about traveling, so people get vaccinated, first dose, second dose, and then before they travel, they still have to do the PCR tests in order to travel? Or are we looking at an approach that's going to be accredited by the World Health Organization, through which traveling would be easier if you have taken the 2 doses of the COVID-19 vaccine?
No, but this is very much related to the previous question about vaccination passport. We cannot guarantee that every individual that have received 2 doses of vaccine have developed a full immunity. Right. And also even the level of antibodies that we are trying to measure, it's not reflecting the level of immunity. The person may have cell immunity, not antibody immunity, and he may have a very low level or 0 antibodies, but be protected. So for that reason, I think we have very little scientific evidence, and we are evidence-based organization, and every time we are making decisions based on evidence.
100%. So when we're talking about the evidence that you've built over the past year, this we did get different, I would say, sources for evidence. But when we're talking about the World Health Organization, the Jordanian branch, do they look at evidences worldwide and accordingly develop the projects in Jordan, or do we specifically do different researches in Jordan along with the health ministry in order to go with what's right to the kingdom itself?
No, of course, we use every sort of evidence. The global recommendation of WHO is based on very wide evidence. It's usually multiple studies which are happening in the different countries. But Jordan has an excellent research community, and a lot of evidence is being generated. And also, over this year, I believe that capacity of the Ministry of Health to generate evidence has increased several folds, and believe this analysis of epidemiological data uses for the action, because this is most important, that you don't just generate evidence, you use it for appropriate actions.
100%. And what have the actions from the World Health Organization, how would you say they've developed over the past year? When the pandemic first hit, no one knew what was going on and what it really was, until we started having evidence. As you mentioned, we learned from the experience of those of where the pandemic started and then moved across the kingdom. How do you think it was addressed in the kingdom, and how efficient was it? And looking at the immunization program that is happening in Jordan, when do we expect to see an actual change with the now that we're living?
Obviously, the knowledge of WHO is a global public health body, and we are a normative organization. We produce norms and standards. We recommend all the countries what to do and how to do. But of course, countries, they choose their own way, and they look if it's appropriate to their context or not. But with Jordan, we have excellent understanding. I think from the day one when we have started, we also had very scarce evidence at the time. We didn't know much. We had only some reports from China. You know that we are so much better now with the amount of evidence we have. We have every recommendation is evidence based, as I said. So we have multiple data, but Jordan as a country has produced so much evidence. So even the decision based on the lockdowns or the public health measures, they are based on evidence. They always and we are also supporting the government in this regard, trying to assess the risk and anticipate the situation.
100%. So, Dr. Wael, if we're talking about the local community, and as the previous panelists mentioned, a lot of Jordanians are saying, we're tired. We're done with the pandemic thing. We just want it to be over. What do we tell them, and what is the message that you'd like to get across to all who are watching us right now, in specific when we're talking about the vaccine and how important it is to get vaccinated?
Tell them I'm just another Jordanian who's tired. But I can't give up, because Jordanians never give up. I'm going to tell them, close your eyes and think of a friend or a family member who lost his or her life, or who was admitted to the hospital. If you close your eyes and think of that, he or she, what can you do for that he or she? So that's our drive, human lives. We work for human lives, whether we are health sector or individuals or institutions. So we know what we're going to do. So we're going to commit to our preventive measures, and we're going to get our vaccine when we are due to get that vaccine. Jordanians are strong guys. They work with love to each other, and we think we're going to add to the humanity by fighting this disease.
100%.
Thank you.
Thank you, Dr. Wael. And Dr. Nara, what are your final remarks regarding this topic?
Vaccination. Yes, I think vaccines save lives. This is as simple as that. So they prevent every year 3 million, and sometimes we are victims of our success, as the number of cases of vaccine preventable disease become less. Like measles is very rare and it's almost not existing in Jordan. People start questioning the quality of vaccine and started kind of spreading all the rumors and having some doubts. So for that reason, I believe that whoever is having any doubts in terms of vaccine, there are so many excellent sources, and the whole, I think, Ministry of Health is producing a lot of Dr. Weil is making a lot of videos explaining why we should take vaccine, and I think it's for us it's we are really having the shared responsibility, as you said before, that Jordanians have been exemplary in sharing the responsibility. So it's our shared responsibility to protect the most at-risk population, which are elderly people, and then try to facilitate the vaccination.
So we received some of the questions that we'd like to share with you and like to hear your answers live on Facebook. One of the questions says, when is this pandemic expected to end? Or do we have to live with it for many years to come? Especially after talking today about the lack of conclusive evidence about the effectiveness of vaccines for some mutated strains. I think this question literally sums up all the questions that people have in mind.
I think yes, we have some evidence. It doesn't work against all the strain vaccine. For South Africa, it has less efficacy, but for UK, which is most prevalent here, I think it works quite well. There's a bit of reduced efficacy in preventing disease from UK and death, but still it's very high, over 80%. So I believe that this is very, I think, convincing for people to get vaccine. And sometimes I believe that it's maybe these days is dilemma of do or die, because it's we don't want to lose people just because they were having doubts about vaccination, but they kind of were prioritized to be protected. So everyone has to exercise their right about protecting themselves, about having the best possible status of health.
100%. I mean, the change is still happening, and I believe a lot of people around the world are still trying to accommodate to the new world that we're living. Do we know when the whole thing is going to be over? No one in this world knows, because no one can know the unknown. But what we know is the vaccine is very important, not only for your health, but your elderly. If you think you're youth, if you think you're young, if you think you're strong and you have excellent immunity, you have to take into consideration that your parents, your grandparents, the elderly in the family, the very young, those who have health issues are not as strong as you are. If you don't want to get vaccinated, that's up to you, but your responsibility to go to get those who are vulnerable vaccinated is definitely on you. Go register right now. The concept is very simple, and there's nothing that's going to hurt you. This is one of the things that we heard a lot. No, this vaccine is going to hurt me. They're going to put a chip in my blood. Why would anyone want to do that? And I mean, watching a lot of movies has made us go with very, very, very big with imagination. But it is a responsibility that I think a lot of people have to take serious. And can I say in your names that the vaccine is safe to get? Yes. That's a yes. Dear panelists, thank you so much for being here with us. Thank you for your time. Thank you for your efforts, for your energy, and everything you've done over this past year. We're looking forward to a more fruitful 2021 and with further success that we'd all celebrate, inshallah, very, very soon. With us be our panelists. Our panel discussion was Dr. Wael Hayajne, Minister of Health, Secretary General for Epidemiological Affairs, and Dr. Idra Liva, Public Health Coordinator with the World Health Organization in Jordan. Thank you so much, and thank you for your outstanding efforts. Ladies and gentlemen, with this, we come to an and be our live for today. We have been live with you for over an hour with the different panel discussions. And allow me once again to thank Dr. Anders Peterson, or Mr. Anders Peterson, the UN resident and humanitarian coordinator, Brigadier General Mazen Faraya, Director of Operations at the National Center for Security and Crisis Management, and Mr. Saverio Belizzi, the emergency team lead of the World Health Organization in Jordan, who were joining us be the first panel discussion earlier today. Our lives are going to be there on Facebook and YouTube. For everyone who didn't get the chance to get their answers or the questions answered, we are going to get back to you with answers. The team from the United Nations here in Jordan is going to take care of that, definitely. Keeping hope in front of us is something very important, and keep having faith in those who have sleepless nights and who've worked really hard over the past year is the least we can do. They are not sleeping for you to sleep in your bed. They are staying up all night to figure it out for you so that you can easily go to work or send your kids to school at a certain point, or even have access to online learning. I know it's been tough. I know it's been nothing like we've ever dreamt of. Many celebrations have been postponed. Many things have changed in our lives. But you know what's most important? Is that you're in good health. And this is one thing we should all be thankful for. دايما بنقول مع الصحة والعافية كل إشي بيجي, and this is something we're definitely hoping to have forever and ever. Thank you so much for being here with us today. كنت معكم لينا الحلواني. It's been an honor to be here with you again, and we're looking forward to more panel discussions that are going to be coming up your way through this platform once again. Have a good evening.